Welcome to the other side of Letby. In episode 16, BBC Part 2, we're going to look at the defence in this case, because I'm really puzzled by all this. I think I'm beginning to realise that when it comes to the law and fighting court cases and things like that, I'm pretty stupid. So I'm hoping maybe someone will give me a little bit of insight into why the questioning went the way it did. We'll just start off with the defence opening statement for BBC. The defence say it is accepted that someone had injected air as a theoretical possibility. So this is the injection of air into a nasogastric tube. That's a very long way from proving what had taken place. So why would the defence admit that there was a possibility that someone had injected air into a nasogastric tube? Maybe that had spam. Now, that simply blows my mind. And Myers goes on to say that the jury would have to look at the practicalities of that and consider alternative explanations. He would hope that they would do that, but he can't instruct them to do that. Or can he? I don't know. But would he not have been better forcing the localities of doing that? How did this method of attack actually take place? Had anyone tried to do this with a nasogastric tube in, say, a balloon or some kind of proxy for a stomach? When did Letby get the time to do this? How long does that take? I know that those are the practicalities, but why would anyone say that this is a theoretical possibility? And if you believed it to be a theoretical possibility, why would you help the prosecution by saying that? Because we know that the cause of death from the pathology report was widespread hypoxic ischemic damage to the heart and the myocardium due to lung disease, with maternal vascular underperfusion as a contributory factor. So we know that when the pathologist examined poor BBC, they found not just ischemic damage to the heart, but widespread ischemic damage to the heart, and particularly to the myocardium, which is the muscle of the heart, and that this was due to lung disease. And not only that, but it's likely that the pathologist, who was a very experienced man, would have been able to give a fairly decent guesstimate of when that injury took place. And also, did it take place over a period of time, or was it all acute, or was it a mixture of two? So why was the pathologist not called to give evidence for the defence? And the defence also said that the pathologist had found acute pneumonia in child C. So it wasn't just the pneumonia, which is a lung disease, but it was other lung disease as well. Would it not have been better to have the pathologist in court explaining to the jury what he found and why he said what he said? If he thought that somebody injecting air into a nasogastric tube was sufficient to cause that degree of damage, and by what means or mechanism did it cause that damage? But instead we have Ben Myers endlessly going on about the gastric aspirates, when we also know that the gastric aspirates weren't mentioned in the post-mortem cause of death. Gastric aspirates can be present with CPAP belly, with distension of the stomach and food intolerance, and that can be due to many things. But again, the pathologist would have been well able to speak to that issue. Why did he not get called for any of these cases? Am I just stupid? Or is raising theoretical possibilities that are so ridiculous a good idea? So, just like to put it in context, just imagine you're at the Magic Fountain in Barcelona. Have you ever seen this thing? And it spreads about 700 gallons of water, or something like that, I can't remember, a second through many jets of water up into the air to create the effect. So imagine that's our CPAP. So say someone had drowned in the fountain, and it was suggested by the police, prosecutors and experts that someone who was the only person present at the fountain actually drowned the victim by throwing a few buckets of water into the fountain 2 or 3 minutes before the drowning took place. Of that person agree that was a theoretical possibility? Or would they laugh in their faces? It's not an exact analogy, but to me it is. The CPAP is pouring liters of pressurized air into the system every minute. So it's like the fountain. The baby's swallowing so much of that. The effects of CPAP on the mesenteric artery, which is the artery that supplies the gut, causes the gut to be immobile, so it doesn't clear this air as easy as it might otherwise. And then there's the prematurity, that the gut just isn't good enough to clear in the same way that we would. And we know from the events of June the 12th, when baby C's stomach was really distended. But Lucy Letby wasn't anywhere near the baby then, so abdominal distension was an ongoing problem with this baby. Why was no one asked to explain why the abdominal distension? Why was no one asked to explain the nature of CPAP belly, why it's so common, and why the notion of someone injecting air through a nasogastric tube is really just too stupid to consider? And we remember that Dr. Ogden on the 10th, when baby C was born, had to intubate the baby because he deteriorated so quickly. Present for that. And remember the X-ray from June the 12th, it was very gaseous as a result of CPAP, according to the doctor that was there. And Myers asking, could that also be termed CPAP belly? And the doctor agreeing. We know that Nurse Williams presented to the court a note written respectively on June the 13th, which shows baby C was still on nasal CPAP with 23 to 26% oxygen. But it's still CPAP. It's still pumping air into the stomach. Give a couple of examples of so 1-month-old boy. With a history of chronic lung disease, admitted to intensive care unit immediately after admission. And immediately after admission, his airway was established using an ET tube. A mechanical ventilation was started. 5 days after commencement of the, it was extubated. Immediately after extubation, high flow started as 20 high flow nasal CPAP therapy was started at 20 liters a minute. Action of oxygen of 35%. Severe stridor was observed. Then a nasal airway was placed in the left nostril. However, he became restless. Feisty? Would that be another word for restless? Abdominal distension was observed. A subsequent chest X-ray revealed that the nasal airway was placed too deeply, and the gastrointestinal air was severely accumulated. Immediately, the nasal airway was removed and the high-flow nasal cannula was reduced to 10 litres a minute, and he had frequent suction and continuous gastric drainage, which achieved gradual improvement of his respiratory condition. We need to recognise that high-flow nasal cannula therapy is one of positive pressure ventilation system. I'll leave you reference to that. And there's a variety of ways in which respiratory support can be provided to preterm infants, like using the nasogastric tube. Supplemental oxygen can be given into the incubator via a heated head box, nasal cannula, continuous positive pressure airways given by a nasal cannula, or a mask, and nasal intermittent positive pressure ventilation, where the addition to CPAP infusions of a higher pressure are given intermittently, so it's not just all the time. There's so many modalities of this, but all of them, sadly, result in CPAP belly. I'll leave you references to that, but the CPAP belly and this abdominal distension all happened before Letby was anywhere near the scene. Nurse Griffiths also said to the police that it was very uncertain what the outcome would be for BBC. And Myers keeps going on about the aspirates from June the 11th to the 12th. Myers, or Nurse Griffiths, does say in relation to the air in the stomach, the nurses did everything they could through the nasogastric tube to aspirate air. So this was a problem from the off. So we get to the 13th of June, and we get a note that says the blood gas reading was very good at 9 o'clock, but BBC was noted to be very unsettled and fractious, which Nurse Williams tells the court was not that uncommon for a baby of this size. And there were no signs of increased work of breathing. So BBC was weaned off CPAP for 2 hours and placed on OptiFlow at 1 o'clock. Now, OptiFlow is humidified heated oxygen placed through the nose. But OptiFlow, even though it isn't specifically a positive pressure device, causes positive pressure to occur. And the OptiFlow will cause CPAP belly as well. And they go on to say, after the OptiFlow, a further blood gas reading was taken later in the afternoon, so that's on the 13th, which was not quite as good. Something that we would have to take into consideration. And that happened after the baby was put on OptiFlow, so we know that from the blood gas measurements, the OptiFlow was not providing sufficient ventilation. And what about the pneumonia? We know that there was pneumonia on an X-ray, which Dr. Alton said she didn't even see. So why was Ben Myers not going on and on about the OptiFlow not being adequate, the one X-ray for the pneumonia, no ultrasound for the pneumonia to see if it was improving? Just no more mention of the pneumonia until the post-mortem. Why did he have to focus on these aspects about the pneumonia? We also then get on to the other night with Letby on the night of the 14th. So that's after this OptiFlow downgrade. That Nurse Joanne Williams recalls that she was a designated nurse for BBC on June the 13th and had cared for him prior to that day. She said that particular day's shift was not too busy, and she recalls BBC was small and premature, weighed 800 grams at birth, and a nursing note is presented to the court written retrospectively at 4:19 p.m. on June 13th, showing BBC was on nasal CPAP with 23 to 26% oxygen. Still quite a lot of oxygen. Oxygen is dangerous stuff. But this is all good science. And then the CPAP decision to wean off, the decision is made to wean off CPAP for 2 hours and replace it with the OptiFlow at 1 o'clock because the baby was so unsettled. But why did Ben Myers not ask who made that decision? Was that a consultant decision? Was that a registrar decision? Who made the decision? There's no information about these really important topics of the relation in this child whose fundamental problem is not aspirates, but is pneumonia and respiratory distress syndrome, and therefore the ability to exchange gas to create perfusion to every other organ in its body. And they keep going on about the baby was stable, despite the fact that they've said that the blood gases got worse, but there's no further mention of any blood gases that improve again. They just keep going on and on about these aspirates. You know, they did call the on-call duty doctor that day, which was absolutely the appropriate thing to do. And again, on the 13th, the abdomen was full but soft, and all quite normal for a baby. It had a slight shine, but not veiny or distended. Why do we have things like ultrasound? Why do we have things like X-rays? Why do we bother doing those things? Because clinical signs can point you in the direction of something, but it isn't always definitive. Note again the 717 grams, the bilious dark aspirates, possibly blood as well. Again, that can be a consequence of abdominal distension on its own. They say that BBC remained on OptiFlow and was stable, but we don't get any more blood gases to know whether that is the case or not. At least now they may have read them out in court. This is the public record, but this is my cause for concern. When Myers goes on, he does pick up a little bit, and he says, Mr. Myers asks if BBC still needed breathing support with OptiFlow and would not have been switched if he had been settled on nasal CPAP. But again, so what he's saying is that, did you make the decision to switch the baby off the positive pressure support that was working to a less effective respiratory support that gave you worse blood gases, only because the baby was unsettled? But why was he asking a nurse that? Why was that not put to a neonatal expert that could explain all that stuff? Again, I really don't see what he hoped to achieve by all this. And then he goes on about feeding, and he goes on about the bile aspirates again, when we know that the bile aspirates didn't appear in the postmortem. So they're ignoring the postmortem again. And this gives Nurse Williams the opportunity to go on in a really distracting manner, in my stupid opinion, that the distended abdomen could be a symptom of other conditions. Yes, it could be, but it wasn't. Then the pop-up prosecutor, Mr. Asprey, rises to ask one more question on CPAP. Would you ever take a baby off CPAP just if they were unsettled? And Mrs. Williams says no. But the decision to take a baby on or off CPAP is not a nursing decision. So there's no discussion about how that decision was made and how many blood gases were done after the OptiFlow was put in place and all of that stuff. But that is the sort of thing that could have been addressed with an expert witness on neonatology. And then we get to Nurse Sophie Ellis. And Nurse Sophie Ellis was the designated nurse for BBC on the night that the baby died. And Lucy Letby was looking after two other babies in a different part of the neonatal unit. And again, this is all just irrelevant. And she said that she was aware that BBC had been moved to OptiFlow and knew the subject of feeds was a topic of discussion and that hopefully they were going to start feeds. Now, this is day 4 and we haven't started feeds. Why have we not started feeds? Because of the abdominal distension. And why is the abdominal distension there? Not because of neck. How can you tell? Because you do an x-ray, there's no gas in the wall of the gut. There's ways of looking at an x-ray and saying, no, this isn't neck, this is CPAP belly. Flow with a stage 25% oxygen, satisfactory respiratory rate, elevated at times, as previously been in the past few days. So we don't know how many times it was elevated, but why was there not a focus put on that? Blood gas reading was to be taken, sorry for the passive language, at 2 a.m. Why not do it there then if you've got elevated respiratory rate and you've had it for a few days? So where are all of the blood gases? Maybe they were read out in court, but they're certainly not in the public record. But all of this, I think, should be the focus. And then they go on about feeds again, and that the baby was doing well, and he was feisty at the time. Could he have been feisty because his gut was so expanded? And is there any measurement of the gut? You can put a tape measure around and you can see whether it's going up or going down. Miss Ellis says in a retrospective note again that he had 2 fleeting bradycardias that were self-correcting, not needing any intervention, shortly before the prolonged bradycardia and apnea requiring intervention. And she said she had left the room just around the corner. Then the alarm went off. She said she could not recall which type of alarm it was, a lower level yellow alarm or a more frequent urgent red alarm. But why was she not asked? Why did she leave the room? She was just around the corner. What was she doing just around the corner? Why did she leave the room? And when she left the room, did she leave Melanie Taylor, who was the nurse that was supervising her that night, because Nurse Ellis was junior? Did she tell her that she was leaving? And where was she going? She said she went into the nursery having been out for not a long time. So what is not a long time? 5 minutes, 10 minutes, 15 minutes? But that is the window of opportunity that Lucy Letby apparently had to pump so much air down into his stomach already full of air and cause this baby to collapse. Knowing the duration of that time, to me, is pretty important. Then she goes on, she recalls upon entering the room, I saw Lucy standing by BBC's incubator. She said she had had a bradycardia and a desaturation. I can't remember what she was doing at the time. She's popped out of the room for not a long time. Melanie Taylor is a designated nurse for another baby in room 1, and she's there to supervise. Sophie Ellis. But when she comes back in, she doesn't see Melanie Taylor, she sees Lucy. Miss Ellis says that she didn't do or see anything being done to correct the desat bradycardia because the baby self-corrected. Then she said she sat at a computer which faced the wall with BBC behind, and she explains Lucy Letby was still in there, but not sure about anyone else. Why would you not be sure that someone else was in the room? These rooms are not massive. Nurse Ellis goes on to say that BBC, Miss Ellis tells the court, had a further bradycardia and desaturation which did not resolve and required resuscitation. She said when she turned around, Lucy Letby was stood at the incubator. But she also said that a nursing colleague had asked her to put out a crash call. So what nursing colleague? Presumably it was Melanie Taylor, who had the other designated baby in room 1. So why is that not interrogated more? Or maybe it was. And she said that before 11 o'clock, Miss Ellis said she had aspirated a tiny amount of light green bile from BBC. A nursing colleague told her to put out the crash call, and Miss Ellis left the room. And she said again that she wasn't gone for very long, and when she returned, a nursing colleague was getting ready to administer drugs and for her to continue chest compressions. She said Lucy Letby was at the side of the incubator, but cannot recall what she was doing. And then the medical team arrived and everything else carries on. None of this really makes a lot of sense to me. A nursing colleague asked her to go and put a crash call out, but Lucy Letby was the only one in the room. Why didn't she say Lucy Letby asked me to go and put a crash call out? So there had to be someone else in the room when Lucy Letby was there. So Lucy Letby couldn't have been in the room on her own. And that the care for BBC was handed over to senior nurse Melanie Taylor following the collapse. She said on cross-examination that BBC was very stable. We know it had pneumonia, respiratory distress syndrome, was on opti-flow, and the opti-flow had caused the gases to go down, and we don't seem to have any more information about how long the gases stayed down, so the baby was stable, and that she was being supported by Nurse Melanie Taylor. And Miss Ellis says there was always a nurse in the room looking after BBC, even when she left the room briefly. She said Lucy Letby was in there and cannot recall if Melanie Taylor was also in there. Would Melanie Taylor, who had a designated baby in room 1, leave the room at the same time as Sophie Ellis, just leave room 1 with no one in it? I don't know. She said she didn't know whether Melanie Taylor was in the room at the time of the collapse, but she does know that her nursing colleague asked her to put out a crash call, meaning she had to leave the room again for a short period of time. And then Myers goes on again about it's a traumatic shift and that there's no mention of the bile-stained aspirates that happened at 8:46 p.m. And Miss Ellis says, oh, I would have forgotten to write it. It was a traumatic event. So she forgot to write that. The baby had aspirates before the trauma happened. But she remembers Lucy Letby being there and doesn't remember if another nurse was there, even though another nurse asked her to put out a call. Myers puts it to Miss Ellis that Lucy Letby was not in there at the time of the collapse and had only arrived during the resuscitation And Miss Ellis says, I don't agree with that. And Mr. Mohr says, you have placed her there when you spoke to the police several years later. And Miss Ellis says, I don't agree with that. Miss Ellis's cross-examination. I don't agree with that. I don't agree with that. So let's see what Nurse Melanie Taylor says. And she's talking about the night of the 12th and 13th, where normal readings were made for heart and respiratory rate. Two of the readings were slightly elevated, so not all of them were normal. But they were normal given the context. The baby C was on CPAP at the time. Normalization. Temperature readings were normal, stable. Other readings were considered to be normal, but we don't know what those other readings were. Other CPAP readings were normal, but we don't know what those readings were. And then we're back onto the bile aspirates in the neck, which wasn't in the post-mortem report. So she confirms that she was present in room 1 that night, in the same room as her colleague, Sophie Ellis. And she said that Sophie was a very competent nurse, no doubt she was. She was completely able to look after BBC. I had no concerns with her. He had been stable. I was there to support if she needed. Miss Taylor says from her memory of the collapse was that she did not know where she was at the time BBC deteriorated. But when she arrived at the incubator, Lucy Letby was already there. Was she out of the room along with Sophie Ellis? Both of them out of the room at the same time, and one was supposed to be supervising the other. She doesn't know if anybody else was in the room at that time. But she recalls, I think also Sophie was there, and she was caring for him. Ventilation support was provided by a neopuff device, and Miss Taylor struggled to get any chest movements for BBC. Miss Taylor said Lucy Letby suggested using a type of ventilation support, and that worked. Good job, she was there then, wasn't it? And then in a retrospective note, written a couple of hours later, she said, called to help as baby had a brady-desat. When arrived, the baby was apneic. So she was called by who? Was she called by Lucy Letby? Was she called by Nurse Ellis? Was she called from the room? Was she called from outside the room? Why were all these questions not asked? Then we get to Myers again. He gets eventually to this mystery of who was there, who wasn't there, who was calling, who was putting out calls. Mr. Myers says Miss Taylor was not sure where she was in the room when the collapse happened. The only person you remember being there was Lucy, and Miss Taylor agrees. She assumed Sophie Ellis was also present. Mr. Myers, it is from your account Lucy is there. No one else is present. Maybe Sophie. Miss Taylor, yes. I'm going to suggest you were in the nursery when this happened. Miss Taylor says she doesn't believe so. Mr. Myers, that it was Sophie Ellis who called you. Miss Taylor, it might have been. Mr. Myers, that Lucy Letby was not there at the start of this. Miss Taylor, I disagree. Mr. Myers says Miss Taylor, in her police statement, said she was pretty sure she was already in nursery room 1, feeding another baby at the time of the collapse. And Miss Taylor says her memory has deteriorated since then, and what is in her police statement is correct. She's pretty sure. Isn't that the legal standard for beyond reasonable doubt? That she was in the room when the collapse took place. Mr. Myers said Miss Taylor's police statement said she was called over by Sophie Ellis, and there is no mention of Lucy Letby. And Miss Taylor says, no, but she was there. Miss Taylor said she read her police statement for the first time this morning and had not memorized everything from it. But what does that mean? Was she given the police statement that morning and asked to memorize what was in it? Is that normal procedure when you're given evidence? Again, I don't know. And then she goes on to say, I didn't say Lucy Letby called me over. I likely wasn't asked by police if Lucy Letby was there. Now I've been shown that statement, I can remember Sophie called me over. So Sophie called her over. That means from the other cot. In the room when the collapse took place. She can remember that now. Years have passed since this has happened. Miss Taylor says she's not changed her mind about who was present, but she just told us who was present. Now that I've been shown that statement, I can remember Sophie Ellis called me over, meaning both of them were in the room at the time of the collapse. At least that's how my stupid mind sees it. I tell you now, when I approached the incubator, Lucy Letby, was there on the other side. There's alarms going off. Of course she's there on the other side. So you're in a ward at night, you're wandering around, you're giving antibiotics, you're doing whatever you're doing. And a code red alarm goes off. You just carry on giving the antibiotics and you don't bother going near the code red alarm. Somebody else is going to do that? No, that's not how it works. So then we get to the shift leader, who's unnamed. The first witness to give evidence. And what does she say about it? She says she remembers Sophie Ellis was the designated nurse for BBC that night. She says Sophie was a very competent nurse, and again, she probably was. The nurse remembers that there was no clinical concerns for BBC at the start of the shift, and that Melanie Taylor will be there for support for Sophie. But surely Sophie didn't need support because she was very competent. The nurse also recalls Lucy Letby was on duty that night looking after at least one different baby in room 3. And she said that she had concerns about that baby. The prosecution asked the nurse about BBC's collapse at 11:15. I do not remember where I was, but I was not in nursery room 1. She recalls a shout for help, but does not remember who called it. She entered room 1 and saw Melanie Taylor and Sophie Ellis, and the nail puff device was being administered. When the call came out of the room and she went in, Nurse Taylor and Sophie Ellis were in the room. She noticed that child C was not breathing and that the heart rate was very low and that the nail puff was causing chest movements, but the baby was not breathing on his own, and that he had a mottled skin appearance. Remembers a crash call being put out and recalls Lucy Letby being present, but does not recall when Lucy Letby entered the room. She recalls Sophie Ellis becoming emotionally upset, and the nurse said she advised her to step outside. We get on to the prosecution asking whose responsibility is it to ensure the memory box is made and who takes care of it. And the nurse says the designated nurse at the time, if they're able. But if you're having a bit of a mini breakdown, are you able? Are you interested? I don't know. And then she says that Nurse Taylor took over as the designated nurse and partly arranged the memory box. The nurse explained she asked Lucy Letby to focus back on a baby in nursery room 3. But Letby went into the family room a few times. The nurse recalled asking Lucy Letby to leave the family to Melanie Taylor. The family don't make any mention of that in their statement, and they just said they wanted to go home, and I wouldn't blame them. It's all about she told Lucy Letby more than once not to be in the family room, but again, the family don't mention anything about that.
The father did say that one of the nurses was quite brusque, and certainly their experience, I know it was extremely traumatic, but their experience was not very good that night. The family, it's worth reading their statements. But the father doesn't say which one of the nurses, and I think he does refer to nurses, plural.
Ben Myers for the defence is now asking those questions. He says that, talks about the busy unit, the number of intensive care babies.
Mr. Myers says something interesting at this point. He says that it appears that the number of intensive care babies arriving in the Countess of Chester seemed more than Arrow Park, the tertiary centre, which is pretty amazing.
And sometimes they weren't meeting staff guidelines for ratios. Myers says that due to the size and prematurity, there was a risk that baby C could die, and this nurse agrees. Then she goes on. She doesn't know whether Sophie Ellis had looked after a baby as premature as baby C before, but she was very confident in her because Melanie Taylor was there for support. She says she does not recall if Lucy Letby had asked her to spend some time in room 1. And then Mr. Myers goes on to ask about baby C's collapse. The nurse says she was not in room 1 at the time, but saw Sophie Ellis and Melanie Taylor in the room attempting to assist baby C's breathing with the neopuff device. Then Mr. Myers said the police statement refers to, I think Lucy Letby was in the room by now. So this is after the collapse. The nurse said she made the statement 3 years after the incident and could not recall precisely when Lucy Letby had entered. And then pop-up prosecutor comes on again and he says the nurse says that she said in her police statement she believed Sophie Ellis and Melanie Taylor were in room 1 with the neopuff when she arrived. And the court hears the response from police was okay, followed by the nurse saying, but I 100% couldn't tell you. Which the prosecution said meant she was not 100% sure. So what percent sure was she? 90? 80? 70? Can we measure these things? What we have here is nobody being really sure who the hell was in the room that night, except the shift leader who said on more than one occasion and agreed that Melanie Taylor and Sophie Ellis were in the room. And if we take all that away, how long could Lucy Letby have been in the room? Because Sophie Ellis said she didn't leave it for very long. Terry Evans goes on to say that Letby took this as an opportunity to sabotage the baby. I think about the fountain again, the 2 buckets of water and 700 litres a minute or whatever it was. But the main thing for me is why did the pathologists not take the stand? Why were they not called to take the stand? I just can tell a lot when I look at histopathology slides when injuries occurred within hours, within a reasonable length of time. But they would, as I say, have been well able to explain the causal chain that led to baby C's death. And I'm sure that they would not have said that a couple of dollops, as I think they were referred to, a couple of dollops of air would have been sufficient to cause death, when CPAP belly doesn't really do that. In podcast 17, BBC episode 3, we're going to look at a case of CPAP belly. We have to remember that even though OptiFlow is not specifically a positive pressure device, it does generate positive pressure. And the problem with that is that it's dynamic, it changes on variable positive pressure, and that depends on the flow rate and other factors like the breathing patterns and the nasal pump fit. The pressure is generally lower and less consistent in CPAP, which might provide the same degree of airway stabilization, but sometimes it is more pressure than CPAP. So none of this stuff is very straightforward. It's technical, and it needed, in this case, an expert to explain all that and not just simplify things. That's just my opinion. I find that maybe with time I'm getting stupider, and you need to have true experts in all of these technicalities there to explain to a jury the uncertainties around all of this stuff. In episode 18, we're going to finish off with the expert witness, evidence for BBC. Bye.